Hello everyone, welcome back to the 72 Dragons Health channel. I am Dr. Pietro Aparicio. Today we will address a significant topic, engaging community stakeholders to reduce mental health inequities in the Hispanic community. Although mental health is an important component of overall well-being, the Hispanic community faces distinct problems in obtaining adequate healthcare services and support. Recognizing these inequities is the first step toward bringing about constructive change. Hispanic people have a greater rate of untreated mental health concerns and less access to culturally relevant care. These discrepancies are exacerbated by language barriers, stigma, and lack of understanding. It is critical to acknowledge these issues in order to work successfully toward solutions. Involving community stakeholders is an effective method. Local leaders, religious organizations, educational institutions, healthcare providers, and grassroots activists are examples of stakeholders. Local leaders have an important role in establishing the mental health narrative. Partnerships with community leaders can be used to advocate for mental health awareness campaigns, stigma reduction, and better access to resources. Within the Hispanic community, religious institutions are frequently pillars of support. Collaboration with these organizations may entail the creation of safe spaces for conversation, organizing mental health workshops, and potentially incorporating mental health awareness into religious teachings. Collaborating with healthcare providers in the community is critical for increasing access to mental health services. Advocating for bilingual practitioners, culturally inclusive therapy approaches, and community-based mental health clinics can significantly improve the accessibility and efficacy of mental health care. Reducing mental health disparities requires a focus on developing culturally competent resources. These efforts include advocating for multilingual mental health experts, supporting culturally inclusive therapy practices, and forming community-based support groups that recognize and respect the culturally uniqueness of the Hispanic community. Engaging community stakeholders is not simply a technique, it is a requirement in the path to minimizing mental health disparities in the Hispanic community. We can create a more supportive and understanding environment for mental health by creating relationships with local leaders, religious organizations, educational institutions, healthcare practitioners, and grassroots activists, and lobbying for culturally appropriate services. We can close the gaps and implement long-term changes in our community if we work together.